everyone. So we are moving on to the appendicular skeleton. We just completed the axial skeleton. So remember, the axial skeleton was everything on your axis, which is the middle part of your body. So what would be included in the appendicular skeleton? So appendicular, like appendage. That would be your arms and your legs, but not just your arms and your legs, the bones that hold your arms and legs onto your body. Okay, so we're going to start with the pectoral girdle. That is going to include two bones. That will be the clavicle, which is the more scientific term for collarbone, clavicle, and then the scapula as well. And then we'll move on to the arm, the forearm, and the hand, and then onto the lower leg as well. Okay, so for the upper limb, the pectoral girdle will hold on the arm. Then we have the humerus. The humerus would be what we call arm in anatomy, because we kind of are more specific when we say arm. So usually when we say arm, we actually just mean this part here, the arm, and then we'll usually say forearm here. So brachial and antebrachial would be the regions for that. Okay, so humerus here, and then in the forearm we have both the ulna and the radius. Then the carpals would be the wrists, and then the metacarpals, and then the phalanges. Okay, so let's start with the pectoral girdle, which again, two bones. We have the clavicle, and we have the scapula. So starting with the clavicle first. For the clavicle, there are two ends, and remember, for anatomy, the most important thing to focus on is shapes. That's what we're really looking at, describing shapes, excuse me, and then naming those shapes. Okay, so those are bone features. For the clavicle, remember that's the collarbone right here. That sort of acts like a strut that connects your arm to your axial skeleton. So it's like this long bone here. And for this one here, I want you to notice that both ends of the clavicles look differently from each other. You have one end that is pretty square and kind of blunt. It kind of just sort of ends. That would be the sternal end, and the sternal end is going to articulate with the sternum, specifically the clavicular notch of the manubrium of the sternum. Okay, so that is the clavicular notch right there. That's where the clavicles will articulate with. So that will be the side that it has this sort of blunt kind of square end here. And then on the other side, the side that's lumpier, that's kind of more rounded, and that is going to be the acromial end. And the acromial end is going to articulate with the acromion of the scapula, right? So this end here, the sternal end, is going to articulate with the sternum. The acromial end is going to articulate with the scapula that creates the shoulder joint. Okay, so that will be what's called the acromioclavicular joint. Because when you're looking at the clavicle, this right here, this is the acromion, and that's where they're going to articulate. And you can actually find it on yourself if you follow your shoulder to the highest kind of point of your shoulder. That's going to be the acromioclavicular joint. Okay, so let's continue on to a couple other things. When you're looking at this here, if you go towards the acromial end, so the one that's going to articulate with the scapula, there's a little point on it, and it's going to be on the inferior surface, so the bottom side of the clavicle. You have a kind of a pyramid shaped bump. And what's the name for a medium-sized rough bump? Okay, so a little small rough bump, that's a tubercle. Remember, they're rough because they're going to attach to muscles. Okay, so that is the conoid tubercle, like a cone, and it's called that because of the shape. It creates a cone shape, so that's the conoid tubercle, and the conoid tubercle is going to be on the inferior aspect, or the bottom part of the clavicle, and remember, it's going to be on the acromial end, the one that is further away, more lateral. Okay, so when we look at it, one of the things that you'll want to know is how are you going to side your clavicle, because when we get to the appendicular skeleton, you'll need to be able to figure out if it is a left or right. Okay, so when we look at the clavicle, this is a bit more of a complicated question than you would think, right? So you really want to ask yourself 3 different questions. What you need to orient yourself in order to be able to figure out if it's left or right. Okay, so the first question I think you should ask for the clavicle is, are you looking at the top of it or the bottom of it? Okay, the superior view or the inferior view. Okay, so do you remember what bone feature is only found on one side, only found on the bottom? That would be the conoid tubercle. So right here, this cone-shaped rough bump, that's the conoid tubercle. So if you orient that down, that makes you so that this side here would be the superior part. Okay, so in this picture here, we don't see the conoid tubercle. There's no triangular rough bump here. And so what we're looking at is the superior view there, the superior view. Okay, the next question we're going to ask is which side is medial and which side is lateral? Okay, so again, when you're asking yourself these questions, you want to focus on bone features that are different on one side than another side. Okay, so for this one here, we're looking at the sternal end versus the acromial end. Remember, the sternal end, that's the square side here. See, it's got the kind of just like it looks chopped in half, nice and square. Whereas the acromial end has a more rounded spot there. So this would be the acromial end, this would be the sternal end. Remember, the sternum's right there in the middle. Okay, so this is the medial side, and this is the lateral side. Okay, so if you can figure out medial versus lateral, this is the medial side, that's the lateral side, and so that's got to be oriented like this, not like this, like this. Okay, and then the next question you need to ask yourselves, well, what's the front of it and what's the back of it? Okay, so when you're looking at this here, I want you to feel your own clavicle. Okay, so when you feel the shape of your own clavicle, hopefully you notice that the clavicle is going to come outwards, like anteriorly first, and then go back. Okay, so you're going to see an anterior movement first, an anterior curve first, and then a posterior curve. Okay, and so that's going to make it so this one right here, once we get it all oriented, we know this is the medial side, this is the lateral side, this is the front, this is the back. This must be a right clavicle. Okay, so it seems like it's an easy question, but it's not actually an easy question. You need to know a lot of bone features and how they fit with other features in order to really answer that question. So I think it's a good practice, and you can help you learn the bone features as you go along the way. Okay, so on to the scapula. Okay, so on the scapula here, this is your shoulder blade, as you kind of learned colloquially, and that is going to look for the clavicle. Right now we're looking on the anterior view, the front of it, and we already learned one of them. So you'll notice that there are 2 kind of major processes that come out. We have the acromion. The acromion is going to be the one that is broader, okay, and on the back, the posterior. So this right here is the acromion. Remember that the acromion is the one that's going to articulate with the clavicle to create your acromioclavicular joint, which is the tall point of your shoulder blade, right, of the shoulder right there. Okay, so the broader, flatter, kind of, broad, flat one, that's the acromion. And then next to it, we have a sharper one. And this one right here is called the Coracoid Process. So corac means crow's beak, and that's where the name comes from, because it kind of looks like a little crow's beak. Go peck, 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 peck. Right, so that's there. So this one here is your acromion, and it's sharper and more round, not nearly as broad. So the broad one, that's the acromion. The sharper one, like a crow's beak, that is going to be the coracoid. Okay, so I think of like coracoid, coracoid, like a bird crowing, like a crow crowing. Okay, so that's the coracoid process there. And then this one right here, this is called the glenoid cavity. Okay, so as always, we want to go ahead and orient ourselves. Okay, so when we look at it here, oh, by the way, the coracoid process is going to help stabilize the joint, and the coracoid process is going to, there's a little ligament that spans across from the coracoid process to the acromion, and that helps stabilize the shoulder joint. Okay, so let's orient ourselves. Okay, so that's the first question we want to ask ourselves is medial versus lateral. Okay, so medial versus lateral and anterior versus posterior. Okay, so let's actually start with anterior versus posterior. Okay, so this one right here, this is the front. And I know if this is the front, the anterior view of the scapula, because it's missing something. The thing it's missing is this right here. Okay, so this is called the spine. So the spine is on the back, and that helps me remember it. Like your spine's on the back of your body, and you can actually feel the spine of your scapula. If you put your hand back in the back there, you can feel that little process, that little ridge that you feel in the back there. That would be the spine. So on this guy right here, right there, that would be his spine. Okay, so the spine is on the back, and then on the front, it'll be flat. No spine on the front there. So that's going to help orient you. This is going to be in the back. This is the front. And then the second thing you want to look at is medial versus lateral. Okay, so what goes right here? This is the glenoid cavity. What goes in that little glenoid cavity? That's going to be the humerus. Okay, so that is where the arm connects to the shoulder. And so are the arms on the outside of your body or on the inside of your body? The outside, right? So this has to be the lateral side. And so this is going to be called the lateral border here. Okay, so this is the lateral side. Here, this edge right here is called the lateral border. And so this part right here that's more vertical here, that would going to be the medial border. Okay, so again, looking at this picture here, here is the medial border there. That's your shoulder blade. And looking at this guy right here, there would be the medial border of the scapula right there. Okay, so the more vertical edge is going to be the medial border, and the kind of angular one there, this is going to be the lateral border. And this is the glenoid cavity where the humerus connects right there. Okay? So it's kind of important. So when we're looking at this, if we make sure that the spine is on the back, and so we know that this is the anterior side, we make sure that this is pointing laterally and this is pointing medially. So is this a left or a right bone? Okay, so is it a left or right? So for those of you who are a little challenged by left and right, I know some of us have a hard time with that. You can make a little L, L is for left. Okay, so this one right here, this is going to be a right scapula. Okay, so what we're looking at from here, this is the back. So remember, if you see the spine, you got to kind of imagine it's switched in your brain. Okay, imagine somebody's facing away from you. Okay, okay, so let's look at some fossas. Okay, so when we look at the scapula, remember here's the glenoid cavity, that's where the humerus connects right there. We're going to notice 3 fossas. Now well, fossae I guess is the plural. So what is a fossa? A fossa. So remember, if you don't know those general terms, those general bone feature terms, you really need to get on this because you'll notice they come back over and over and over again. So the fossa is a depression. Okay, so a basin-like depression. Think of like a sink. Those are fossa. So when we look at them, there are 3 fossae on the scapula. Okay, so we're going to start with the back first. This is the posterior side right there. Looking at the posterior side, you'll notice that there is one fossa that is above the spine. That is going to be the supraspinatus fossa. Supra means above, as in superior. Okay, so the supraspinatus fossa is the depression above the spine. Okay, so it tells you exactly what it does. And I'm hoping that you're starting to notice that as we go through anatomy, there's got these long, complicated words and these big, long names, but they're just describing exactly what they are, right? So if you know the terms, you already know what it is, right? So here we have a depression above the spine. What do you think this one below the spine is called? Okay, so this whole depression is one depression. So here's the supraspinaeus fossa above the spine, and this one, this whole one down here, that would be the infraspinaeus fossa. So again, the depression below the spine. So supraspinaeus fossa and infraspinaeus fossa, both of them are on the posterior, the back side of the scapula. Now, if you flip it over and you on the front side of the scapula, the anterior aspect of the scapula, you have another depression, and this one is a rather kind of shallow depression, but it's really big. It takes this whole space here. That has another name, and that is called the subscapular fossa. So remember that the infra and supraspinaeus fossas are on the back, the posterior side, which hopefully makes sense since the spine is on the back, your spine's on your back, whereas the subscapular fossa is going to be on the anterior side. Okay, so let's look at a little bit of where that name comes from. So imagine you're somebody, you're a scientist, you've never dissected the body, and you're dissecting a cadaver. If you're trying to dissect bones, the scapula, you're going to be dissecting with the person facing down. Okay, they're going to be what's called prone. Okay, so they're facing down and you're dissecting them. How are you going to get to this fossa? It's going to be underneath the spine, underneath the scapula. It's subscapular, right? So sub is underneath. So that's where that comes from. Okay, so this is the subscapular fossa on the anterior side, because if the cadaver is facing away from you, it would be underneath the scapula. Hopefully that makes sense to you. And anytime you can tell yourself a little story like that, it'll help the name stick. Okay, let's see, what's next? I think that's all for there. Oh, I did want to mention the function of those fossa, the fossae. So the reason that you have those fossae is here is because that's where bellies of muscles sit. Okay, so for example, here's your spine right there. If you look above the spine, sitting in the supraspinaeus fossa is a muscle that's called the supraspinatus muscle, right? So it's kind of like a 2-for-1, although be careful when we do get to muscles. Please notice that there is a difference in spelling. This is supraspinaeus, O-U-S, and then this one is supraspinatus. So there's a T in there and no O, okay, spinatus. But they're named from where they sit. So here's a supraspinatus muscle would sit right in the supraspinaeus fossa, and you have an infraspinatus muscle that sits right in the infraspinaeus fossa. And then even on the back, you have subscapularis muscle, which sits right in the subscapular fossa, right? So if you can tie these information together, it'll help you remember. Okay, so we're going back to muscles. Don't learn the muscles yet. I just wanted to show them to you so that when we get there, you'd be like, oh yeah, I've seen that before. Okay, so I'm gonna go ahead and stop it, but just so let's give you a little preview of where we're going next. Okay, so here's our scapula. What's gonna fit right in that glenoid cavity? Ta-da! Okay, I'm gonna stop it. We're gonna move, make a new one for the rest of the arm.